My name is Brian Smith. I'm the Director of the Office of Performance and Innovation and the Interim Director of Strategic Management of the City of Minneapolis, out of the Coordinator's Office. And we wanted to invite you here today so that we could give you an update on the reimagining public safety work. That will be the only thing that we'll typically talk about in these press briefings, because we want these briefings to be focused on the actual work of people in the city around those things. So questions about police, questions about amendments, questions about anybody on the third floor in City Hall and how they're responding to things in this political climate is not what we're here for. We really just want to tell you about the good work that staff are doing across the enterprise to actually address reimagining public safety from the alternatives and violence prevention perspective. So with that, I'd like to introduce my colleague to the right, Saray Garnett Hohuli.
Thanks, Director Smith. So I am regulatory services and traffic control falls under my umbrella. And part of this reimagining is looking at things that some of the departments currently do. And the parking pilot is something that fell under traffic control, which is under regulatory services. So I believe 2 years ago, the coordinator's office started to do research on what are the things that the MPD does after hours, and if it was falling in certain departments' buckets. And this parking pilot actually fell under traffic control. So over the last 2 years, we've managed to look at data, look at resources, and the decision was made to extend traffic control's hours from 11 to 7:30 a.m. And what this does is it allows parking complaints from 911 and 311 to be serviced by traffic control rather than MPD. There have been issues where people called in to have issues addressed, and it just wasn't to the level of priorities from an MPD perspective. So what this allows is traffic control currently does this work in the day. Now we will continue to do it 24 hours a day, Monday through Friday. We currently have 3 staff. Do you have a question?
Well, so not Saturday, Sunday?
That's correct. Right. So we have 3 staff and 1 field supervisor who is going to be doing this work.
Right.
Yes. Good morning. I'm Sasha Cotton, the director of the Minneapolis Office of Violence Prevention, one of the critical partners in the reimagining public safety efforts here in the city. I'm going to talk about 2 of our upcoming bodies of work, just to give a little bit of highlight on what the Office of Violence Prevention has been doing. The first of them is our Office of Violence Prevention Fund, which is really focused on innovating public safety and violence prevention. We look at our work in a couple of buckets in the Office of Violence Prevention, one of them being building capacity and innovating violence prevention. We recognize that it's important to follow evidence-based practice and the best research out there, but we also know that Minneapolis residents have a good sense of what they need on the ground. And our Office of Violence Prevention Fund is deeply focused on funding local agencies to implement strategies that they believe will make a difference in keeping their communities safe. And through the American Recovery Act, we were able to distribute another 20 grants under the Office of Violence Prevention Fund. We're in the process of standing up contracts with 20 agencies who are serving the diversity of Minneapolis. I'm able to share that a couple of the agencies who we have selected include the American Indian OIC to do some work around reentry services with a particular focus on mental health and wellness. We'll also be working with Emerge and their North 4 program, which is specifically focused on young men of color who have been involved in groups and gangs, providing them with employment and training opportunities to really take their lives to the next level around safety. And then we're also funding Clues, which is a Southside serving organization primarily focused on the Latinx community, who will be doing art activation and space activation related to Latino heritage and reoccupying space that otherwise sometimes is compromised by violence. And as I said, there are 20 agencies that will be funded, and a full list will be made available when those contracts are fully executed. And then the other project that we wanted to make sure that we were sharing here today is the Community Violence Intervention Initiative, which is a White House initiative under the Biden administration. Minneapolis, along with St. Paul, are one of the 16 cities that have been identified to participate in this White House initiative, with the goal being to really poise some of the cities that are addressing violence prevention right now to take their work to the next level. The first step will be a landscape analysis, which is really a way to look at what kind of services and resources do we already have here in Minneapolis that can address violence and violence prevention, and what do we need to add to make our communities safer. And so we'll be doing that landscape analysis over the next week. They'll be coming back to us with a plan on strategies that we should be considering. And then the desire is that this will ultimately lead to potential federal funds to do increased violence prevention work across our city. So we're very excited to be one of the 16 cities that have been selected. Our office is taking a lead role in helping to roll out this initiative in Minneapolis, and we look forward to the opportunity it also presents for us to look at the geographic nature of the Twin Cities, given that St. Paul is a partner, and it should allow us some opportunities to work more closely with them as our neighboring city. And I think that concludes our update from the Office of Violence Prevention.
Okay, so one of the things that the Office of Performance and Innovation, almost said violence prevention, we've been working under a staff direction that was given in 2018 and updated again in early 2020. So what we were tasked with doing was looking at all problem nature codes in the city to determine which problem nature codes fell outside of a state mandated peace officer response, and those problem nature codes that could have an alternative response because there was nothing in state law requiring a police officer to go to. So I wanted to make that clear distinction that there are things that police officers absolutely have to respond to and should respond to, and then there are other things that under reimagining public safety you can look at alternative responses to which don't fall under state purview. And so when we began doing that work, the things that rose to the top were 911 calls where MPD were having to go and take reports for theft, for cars getting swiped, for somebody's bike being taken out of their garage, and just people just being used to MPD coming for whatever they might wanted to file a report for. And the city was responding in kind by sending officers, and they would spend upwards of 45 minutes to an hour on a call taking a report, which when nobody was in danger or anything like that. And so we began to look at things like that to see how we could create an alternative response. And that's why we have the transfer of theft only and report only calls from 911 to 311. And people can file online, and those calls will not have a police response, so that police can be available for things that they need to respond to, especially under state statute. In that work, we also came up with a need to have a mobile behavioral health response in the city. And so out of that research, out of working with Hennepin County psychiatric leadership, psychological leadership, community organizations, residents, internal city staff, and service providers, what rose to the top around that was we needed a mobile behavioral health unit that was more community focused, not systems focused or systems run, that could be more responsive to people in the community, and a response, again, these are alternatives to police response, and a response that did not require the presence of police at every call unless absolutely necessary. And so that's where we came up with our mobile behavioral health response. Got a vendor, Canopy Mental Health, that'll be rolling that initiative out mid to end of November. What we're doing in preparation for that, as we've gone through this process and we had some aggressive timelines about when we wanted to do this, for every step forward, we find out there's other things that we need to do. So around training, background checks, CAD training, PIMS training, a background check that literally can take 4 to 8 weeks, but typically around 4 to 6, can be done sooner in some instances. We have to make sure that these folks are trained with 911, they're trained on radio, and so as we were aggressive in thinking, oh, maybe we can do something in May, maybe we can do something in August, we were starting to find out that there's just a whole bunch of nuanced, detailed things that need to happen and trainings that need to happen before people can go out to the street, and that's why now we're looking at November. So we're also providing our 911 workers with an extended 3-day training. So all 911 staff will be trained by the 911 Training Institute, who specialize in mental health 911 calls, to make sure that 911 workers do a better job at triaging calls that they're actually not specifically trained for, which now they will be, and there will be a certification at the end of the training. And it's also focused on taking care of their mental health, since what they do is hear literally emergencies all day long, which can be quite traumatic, and we want to make sure that we can take into account that they understand how to take care of themselves while trying to take care of others. So we're doing that for all of the 911 staff. And I think that's about all I have to offer right now. But I think it's very important to note also that all the work that we're doing here is not a response to George Floyd being killed in 2020. The city was trying to be very proactive in making sure that we could look at alternative responses and how we could reimagine public safety. Because again, this work started back in 2018. And it's important to note also that we're in an environment where people say they're rushing things because they may have heard about some stuff publicly in 2020. But we've been at this again since 2018. We've been purposeful and thorough, and in doing so, the very things that we've been accused of in some instances about rushing, as evidenced by the timeline I'm giving you, it's clear that we're not rushing. But then the very same, in some instances, the very same people who are now saying what's taking so long were the same people who are saying, why are you rushing this? And so I want to just let everybody know that we've been engaging with community across all of these programs and initiatives to make sure that it's really something that the public says they want, that is meant to help the end user, that it's not just designed by some people in a lab or some directors at the city who think they know what's best. And so when you do stuff like that, you have to be thorough, you have to take your time, you have to test things, and that's what we do. And so there's more to come, but I wanted to let you know that that's the process that we engage in with community and our internal directors and departments here at the city to get anything done. So with that, I guess we can open up for questions.
Yeah.